Welcome, everyone, and thank you for joining us. My name is Molly Felton, and I'm the Online Education Specialist here at APIC. The Association for Professionals in Infection Control and Epidemiology is pleased to present this webinar in partnership with the American Nurses Association. Today's session is titled, Practical Tips for Healthcare Workers in the Current Monkeypox Outbreak. Before we get started, I would like to go over a few items for our participants. Please note that this presentation is being recorded and will be available within 48 hours. We will notify all attendees once it is available. We encourage you to submit your questions at any time during the presentation using the Q&A tab at the bottom of your screen. If you need technical assistance, please send us a message in the chat box or send an email to elearning@apic.org. And now it is my pleasure to introduce the Executive Director of APIC Center for Infection Prevention and Control Research, Practice, and Innovation, Shanina Knighton. Shanina, welcome to the program.
Thank you so much, Molly. So on behalf of the American Nurses Association and the Association for Professionals in Control and in Epidemiology Rapid Response Work Group, we want to engage you in our joint effort against the monkeypox virus. As we know, the monkeypox virus in its current form, has only been around as of May 2022, which is not that long ago. And when I say it's been around, it's began to travel to countries where there had been no previous cases. And in many of our lessons learned from COVID-19, we know that preparation is so important and it's an intricate part of making sure that we can lower the risk for transmission. In effort for us to be able to meet our goals, we want to provide practical and adaptable tools to the frontline workers and individuals that they care for. We want to address the stigma around monkeypox just in itself by providing educational resources. And we want to make sure that we can also provide practical tools for individuals to care for themselves in the communities and at home. So in today's webinar, we will have a discussion that will focus on monkeypox virus signs and symptoms and risks. We'll talk about the importance of PPE and common mistakes that are made that can lead to infection transmission. We'll introduce the application of our healthcare worker screening tool to assess for and monitor monkeypox virus. And we'll actually talk about next steps and focus areas for future webinars. But most importantly, we want to engage you in Q&A, as well as even hear some of your comments about future topics that you believe we should cover. And now at this time, I would actually like to just tell you a little bit about our team. So as Molly mentioned, I am APIC's Executive Director for Research, Practice, and Innovation, and I have a background in nursing, and I am an infection preventionist. I will serve today as your moderator. Our next is our speaker, Anna. Anna is an education specialist at ANA and has over 15 years of clinical experience as a family nurse practitioner with an emphasis on implementation of public health initiatives at the local, state, and federal levels. Barbara Smith, another speaker, is a nurse epidemiologist, infection preventionist, and consultant for ambulatory practices, including surgical care, endoscopy, dialysis centers, to many organizations, including Mount Sinai. Barbara is on the advisory team for our Emerging Pathogens Task Force. Donna Zankowski is an occupational health nurse with over 37 years of experience, with a professional focus on improving the work environment for healthcare. She currently consults for the American Nurses Association Response and Resource and Education team. And last but not least, we have Jennifer Shepard, which is Dr. Shepard also, who currently serves as the Director for the Nursing Education and Product Management for the American Nurses Association. She is a clinical leader in the roles of dedicated professional development, analytics, leading teams to implement and cultivate innovative strategies. She will serve as a speaker on our Q&A panel at the end of this session. And now at this time, I would like to just present a polling question before we get started. I want to know, have you been around someone with monkeypox? So we do know that it's recent as of May, but we just want to know what exposures are even looking like even right now in the United States and even in some of the environments for where you may work, live, or play. Okay, and so do we have the results? Okay, so 88% of our audience has said no, 9% not sure, and 2% yes. And I'm bringing this up only because, as we know, everything is emerging just like COVID-19 emerged. So it's important for us to be prepared and ready, opposed to us trying to understand solutions afterwards. And so with that, Anna will provide you with a brief overview of the monkeypox virus.
Thank you so much for the introduction. Welcome, everyone. So I'm going to just briefly discuss what monkeypox is and what the signs and symptoms are. So the monkeypox is a viral disease that can be spread between people or between people and certain animals. It is part of a larger category of species of viruses called orthopox virus. Another member of this family of viruses that you may be familiar with is the variola virus, which is the virus that causes smallpox. But unlike smallpox, which we know can be very deadly, monkeypox is less likely to lead to death or complications. Chickenpox is not related to this group of viruses and therefore is not related to monkeypox. Next slide, please. So how is monkeypox spread? Well, to date, we have come to understand that monkeypox spreads predominantly by having close contact to an infected person's active pustules, pimples, fluid-filled bumps, and scabs that can present as part of the monkeypox rash. Due to the nature of the skin contact to other surfaces, spreading can also occur by ways of touching objects or fabrics, such as clothing, bedding, or towels, as well as surfaces that can be used by someone with monkeypox. The virus can also be present in someone's saliva, and it can be carried in the person's mouth. So contact with respiratory secretions is also a concern. Intimate contact, especially prolonged, such as in face-to-face contact, hugging, massaging, kissing, and oral, anal, vaginal sex, or touching genital areas and anal area, can also lead to exposure. Next slide. In this slide, you can see some pictures of what the monkeypox rash can look like. It often presents in the hands, feet, chest, face, and mouth. Outbreaks can occur in rash in genital areas and in the anal area. As you can see in these pictures, the rash goes through different stages, including scabbing before healing. As I previously mentioned, monkeypox can present in saliva, mouth, respiratory secretions. Therefore, it is important to remember that droplets from an infected person can occur from coughing. So lesions in the mouth can also be present, but remembering that that can also lead to a way of transmission. But it's important to note that the rash can present in different stages, and it can look like pimples or blisters, sometimes painful, sometimes itchy. You may see a lot, or you may not see many lesions, but know that if you find anything of concern, it is something to have evaluated. Next slide. So what are some of the symptoms that can occur with monkeypox? Well, a lot of these symptoms can be very similar to other conditions that we are currently concerned about. So as you can see, fever, chills, swollen glands, exhaustion, muscle aches and backache, headaches, respiratory symptoms such as sore throat, nasal congestion, or cough. So a lot of these symptoms, like I said, mirror other illnesses such as the flu or COVID, which is why preventative strategies such as hand hygiene is one of the single most important ways to prevent germs and germ transmission, and proper use of PPE for contact and droplet precaution, very important to protect ourselves from transmission. At this time, I'm going to pass it over to Barbara to discuss a little bit more about PPE.
Okay, so as we're waiting on Barbara, I will get us
Thank
started
you,
out.
thank you.
Okay.
Thank you, Anna, and thank you, Shanina. So we've covered the areas that we're concerned for in terms of getting exposed to monkeypox. What can you do as nurses and healthcare workers to protect yourself from getting in contact with it? The CDC is recommending both contact precautions and droplet precautions. And in fact, it's really a special or enhanced droplet precaution, because in addition to just using a surgical or an isolation mask, we should be using an N95 anytime we're entering the room or the exam room of somebody with known or suspected monkeypox. This is especially true if there's an aerosolized generating procedure going on. As with any type of precautions or any type of patient care, we want to wash our hands before going in and coming out. And in terms of monkeypox, unless your hands are visibly soiled, alcohol-based hand rubs are completely acceptable. We do want to wear eye protection. As we said, this is the enhanced part of the droplet precautions, and there's many varieties of eye protection available. The gloves and gowns should be placed on before you enter the person's room, and of course removed within the room so that you're containing the potentially contaminated material within the room. If it's possible, please keep the door closed. And then we can tell what else we can do to help protect ourselves in terms of precautions by wearing our personal protective equipment correctly, as we might see on the next slide. We know that we've all been wearing, well, most of us have been wearing different types of personal protective equipment before COVID, during COVID, and as we go through the rest of COVID. And we know that people can be sometimes a little bit careless when they're using this personal protective equipment. So we'd like to stress a few points that you could reintroduce or reinforce with your staff members. Sometimes people are forgetting to perform hand hygiene before and after glove use, especially after taking off the gloves. They may be handling shared equipment or personal equipment like stethoscopes incompletely and not disinfecting them. I often see people not donning gowns correctly, and more importantly, contaminating themselves when they're taking their gowns off. We'd like to also point out that the gown and the gloves should be covering your entire hand, forearm, so that we don't want to see any gaps of skin at the wrist. Excess clothing like hoodies or sweaters and excess jewelry are going to compromise your ability to put on your PPE and take it off correctly. So we'd like to minimize the amount of excess clothing. Of course, you're going to be wearing a uniform or some type of personal clothing, but no, we don't need excess things like lab coats and hoodies. We can see from the next slide that we have some people that could use some of your coaching. So our next question is, what's wrong with this picture? How would you coach this person on her PPE? Question A is tie her hair back. Answer B is jewelry will interfere with thorough hand hygiene. If you think she looks fine, you can pick the number C. And finally, D is both A and B could use some improvement. Did we give it enough time? Oh, there you go. Oh, I'm happy to say that 94% of us chose D, which is, I think she can tie her hair back and that she should minimize the amount of jewelry. And I think one person chose C, but I think she was just hitting the wrong button. So that's great. I think more importantly is, do you feel comfortable, and this is not a polling question, do you feel comfortable telling your colleagues when they're not in good use of PPE? Especially when they're taking off their PPE so that they're not accidentally contaminating themselves. Let's see what else we can learn. We can't go without mentioning how important hand hygiene is. And I think that if you saw somebody with these monkeypox lesions, you would be very encouraged to do good hand hygiene, both before you enter this patient or resident's room and as you're exiting. Make sure that you're using thorough friction if you're using soap and water, and that you're using alcohol-based hand rubs, that you let them dry completely. We have some other tips in terms of how we can keep our hands safe from infection. You can imagine if your hands look like the picture in the lower frames, that you could have monkeypox virus in there. Wouldn't that be awful? So please keep your nails short with no chipped nail polish. And if you do look like that, you need to get a scrub brush going and getting rid of some of that debris that's under there. Clearly, we're not going to share any of our grooming tools, and we should be cleaning them regularly for ourselves. Now let's think of some other things that we can do to keep ourselves safe. We want as much as possible, we want to use disposable or dedicated equipment in this person's room. If we're using dedicated equipment, you need to have your system really well defined on who's going to clean the product and what product they're going to use to clean it before another patient or another resident has that piece of equipment. We're including multiple things in here, such as IV pumps, a cell phone, the translator, monitor, an EKG machine, and any other supplies that go in and out. If possible, try to get something that you can leave in the room until the patient is discharged, in which case you can do a thorough cleaning. If possible, don't bring your cell phone into the room, but obviously there will be some equipment that does need to be cleaned and disinfected. And I think on our next slide, we'll tell you what the CDC is recommending for that. Oh, not quite. Next, there'll be the slide after that. The question comes up is that sometimes these patients will need to leave their room, and they should only be leaving for medical reasons, not for social reasons, obviously. So limit the transport of the patient to essential transport only, for instance, to radiology. Have the patient wash their hands before they leave. You're already gloved and gowned, remember, because you followed the right protection. The patient should be placed in a clean gown and then cover all the lesions or his body in essence with a sheet or gown. Have the patient wear a surgical mask. And then when you're finished, the patient should have the stretcher or wheelchair, however you got the patient to the next department, needs thorough cleaning and disinfection. And clearly, most importantly, is to have an alert system so that the receiving department, whether the patient's coming from the ED to the nursing unit or from the nursing unit to radiology, for instance, that there's some way that the receiving department knows that this patient is known monkeypox or suspected monkeypox. Lots of different ways to do that. Monkeypox, as Anna had mentioned, is a virus, and it's in the tier 1 enveloped virus categories, which means that it's easier to inactivate than certain other viruses or certain other spores like C. diff. You should make sure that the disinfectant that you're using, whether you're in the home situation or in a healthcare setting, is an EPA registered product. And you can look that up. There's a link on the bottom from the EPA's website. Look for the Q list, like the letter Q, and it'll tell you what products are effective against these organisms. I think the links are also in the chat. I think Natasha's telling us. Thanks, Natasha. So also remember, and this is important regardless of what organism you're trying to inactivate, the contact time is really important. So it will vary with what product you're using. Check also if your disinfectant can both clean and disinfect at the same time, or do you need to pre-clean and then use the disinfectant? But it's nice to know that it's pretty easily killed. And then we'll see what else we can learn from this. The patient with monkeypox or suspected monkeypox is on contact in that special droplet or enhanced droplet, but does not need a special air handling like a negative pressure room. The only exception to that would be if the person was going to have an aerosolized generating procedure, such as becoming intubated, or if you're going to extubate them. Fortunately, as Anna said, most of the cases that we've seen have not been so severely ill. So perhaps this won't happen as often as it did with patients that had COVID. We do want them in a single room, and it would be preferential to have a bathroom in that room for the person. If you don't have a dedicated bathroom, you'll have to consult with your infection preventionist, your nurse managers, on how the strategy is for toileting this patient. Make sure that the people in your department are contacting your infection preventionist, and you probably will need, most places will have an ID consult in case the patient needs treatment or if his contacts need some kind of prophylaxis. One of the differences among this disease is that we do want all of the equipment, including the personal protective equipment, i.e. the gloves, gowns, etc., placed into biohazard trash bags. Usually that's that red bag. So it might be easier to remove the regular trash so that people don't get confused, and put too much garbage in the clean, so to speak, clean trash. The linen should be bagged in the patient's room. And as we'll see in the next slide, we want you to be careful handling the laundry. So remember back to your original training in healthcare, whether you're a nurse or a nursing attendant or a respiratory therapist or whatever department you're from. We don't want to be shaking the linen because that may disperse more of the organisms into the air. Make sure that the linen is placed gently into the linen hamper, whatever type that you're using, and then it can be handled like the rest of the linen into the soil laundry stream, however that's handled in your facility. Because things like dry dusting or vacuuming can aerosolize those dry particles that might be on the sheets or might be on the inanimate furniture, we should avoid that. We're preferring wet cleaning methods in terms of disinfecting the area that the resident or the patient has been in. I think I'm ready to turn it over to Donna, because as most people are concerned, you may have done everything possible, but you're still worried about being exposed to monkeypox. And Donna has some key points to make about what to do if you are exposed to monkeypox.
Great. Thank you so much, Barbara. Thank you everyone for being on the call. I'm so glad that you are spending time with us to learn more about monkeypox. So we're switching things from looking at a patient focus, and now we're going to look more at an employee and a healthcare worker focus. So as Barbara said, regardless of our best intentions, occasionally there might be a situation where a healthcare worker is going to become exposed. The CDC actually gives very good guidance on what they are suggesting that be done with those employees, but it's all on a web page. It's maybe not easy to navigate, and not everyone is necessarily going to be able to go to the web page if they want to just do a screening to figure out how serious the exposure was. So we realized that there was really a need to have a usable tool that could be adapted to each facility's policies and procedures. We're thinking that this tool can really be used by everyone as long as you adapt it with your own policies, right? So if you're a big medical facility, you're going to have an infection control plan. You're going to have an occupational medicine department, and you might have a lot of policies in place already for how to handle communicable diseases among employees. But you might be a small clinic or maybe at a doctor's office, and you don't necessarily have access to all those folks. How will you screen your employees if they feel they've had an exposure? Again, you're going to think about how can we use this tool, and how can we best figure out how serious the exposure is, and then send the employee on for further treatment or evaluation if it's necessary. So next slide, please. Okay, so the first thing is this tool is available. There's a link in the chat. It's also going to be up on the APIC webpage, and it will be on the ANA webpage in a day or so. So the first two questions you're going to ask basically are, have you had a close or intimate contact with someone known or suspected to have monkeypox? The suspected part matters because sometimes folks have had their testing done, but they don't have results yet. It looks like monkeypox, we're not really sure. So we're going to also treat that as a potential exposure in that interim waiting period until we really find out. Second question is, do you currently have any symptoms? And I know Anna already went over all the different symptoms. And basically, if you have a symptomatic employee, the most important thing is that that employee needs to be removed from the workplace, right? They cannot work. They'll still need to be referred to some type of treatment and evaluation for treatment. And so depending upon your facility, again, you might be sending them to your employee health. You might be sending them out to a contracted out employee health. You might even be sending that employee to their own physician's office if that's how you are managing your employees. Next slide, please. So once we know that an employee has had a potential exposure, we need to evaluate how serious that exposure was. And this all comes from the CDC website. So we pulled directly from that and created this checklist tool. So depending upon the type of exposure, is going to give you some guidance on what you might need to do next. So next slide, please. We're going to get into it a little bit. So, has your employee had an unprotected skin contact with someone's actual lesions or body fluid of someone that highly suspected or known with monkeypox? That would be considered a high-risk exposure. Was there an aerosolized procedure happening and the employee wasn't wearing an N95 and didn't have significant, eye protection or a face shield or something? That could be considered a high-risk exposure. It's important to note that high risk and intermediate risk exposures, those employees can be evaluated for treatment. And so as we categorize things, be thinking about what your next step will be. Will you be referring this employee out? So next slide, please. So intermediate risk. I see someone's having difficulty with slides. I'm sorry, I guess we're working on it. Hang in there, we are working on it. So are you within 6 foot of an unmasked patient for a really long time, greater than 3 hours, and you're not wearing an appropriate N95? Or, you have your N95, you have your eye protection, you have a gown, but something's happened to where your sleeve was pushed up and you accidentally, exposed part of your blouse underneath, became contaminated. Maybe you didn't have a gown on, and you thought you were doing really good with just handling linen with just your gloves, but it brushed past your uniform, that's probably an intermediate risk. Okay, next slide. There we go. So, did you forget to wear eye protection? Well, as long as there was no aerosolized procedure, the patient, doesn't really have oral monkeypox. Maybe they're there and they have it, more genital monkeypox. Is that really a significant exposure? Maybe that's more low risk. You still are going to want to monitor this employee, but they're probably not going to be eligible for prophylactic treatment. Next slide, please. So at this point, you've completed that assessment of the type of exposure, and now you're going to do your referrals. And there's a box here on this slide. The CDC has all these great resources for symptomatic employees, right? So it's important to have these available even for your asymptomatic employees who will be monitoring themselves at home, because then they'll have those resources to know what to do. So I believe these links will either be in the chat or they'll be accessible in the PowerPoint after the presentation is over. Next slide, please. Okay, so if you have an employee that is asymptomatic, I'll start asymptomatic first. That employee can continue to work even if they've had a high-risk exposure or intermediate or low. It doesn't matter because they are not symptomatic. They can continue to work, but they're going to need to be monitored for the next 21 days, right? So whether or not your employee can monitor themselves or they need to be monitored more in person depends on your facility, your capacity to monitor your employees, and the employee's ability to self-monitor. It really depends. Healthcare workers aren't always clinical. If we're thinking about a big medical facility, there's dietary and facilities might be changing a light bulb, and, housekeeping has gone through and the lab came by, and, are all those workers going to be able to reliably self-monitor? That's a conversation that you'll need to have with that employee. And also you need to have a good policy around that. How are you going to have your employees self-monitor? Who are they going to report their symptoms to if they have symptoms? Are you going to do everything via the phone? Maybe telehealth. Could you have them call in maybe for the daytime assessment and maybe do their own at night? I mean, you're going to have to figure out according to your policy and your worker population how to manage this. But if they are asymptomatic, they most likely can self-assess at home. If they're symptomatic, they cannot work, right? They must immediately be removed from the work environment. And again, you're going to have policies and procedures in place for what to do with that symptomatic employee. Now, many of them can manage their own symptoms at home as long as they're not severely ill. But again, you know, giving them some resources and referring them to the right department, because they might, symptomatic employees might also be eligible for treatment. So it's important to refer them to the proper place, and then make some decisions about, and I believe this might be on the next slide. Nope, it's not. I apologize. We can keep it there. But they're going to need, symptomatic employees will need to make some decisions in terms of when they're going to be allowed to come back to work. And again, that should be within your policy for your facility. So think some of that through. Monkeypox is a reportable illness. So someone's going to need to be communicating with the local public health department. And again, you know, is that your infection control person? Maybe your facility only has, you know, one person that's a manager. It's a doctor's office or a small clinic. Who is going to be making all those contacts and referrals? So this is the self-monitoring tool. And again, it's going to have to come with a big side order of education for that employee. You might want to add photos for the employee so that they can assess themselves for a rash if you think that's appropriate. I have a link here at the top of this form where you can actually pull those images from the CDC website if you want. The employee needs instructions on how they're supposed to self-monitor, when they're supposed to self-monitor, who they're supposed to report to if they have symptoms. They're basically going to be twice a day before their shift. Should be one of these assessments, is right before they come to work, because they're still working if they're asymptomatic. You know, temperature, do they have a rash, and do they have swollen glands, and can they assess their own glands? And so I think I've covered pretty much everything on this. I know you're going to have a lot of questions about it, and that's fine, but I'll stop here, and maybe we'll get some of those questions on the back end. Thank you.
Thank you so much, Donna. That was absolutely amazing. And I actually, before we even start thinking about Q&A, I just want to get a quick polling question. So understanding that we haven't gone through, let's say, every single page of the tool, and you're now being introduced to the tool, we want to know, like, if you feel that this healthcare worker screening tool will be helpful to you in your practice setting. We'll give it about another few minutes, or another minute. Okay, and thank you. So 72% of our audience feels that it will be helpful, 1% no, and 25% maybe, and we have 2% that are unsure. And so just as Donna highlighted, I can't emphasize this enough, the goal is to make the tools practical, and so they are editable. They are there for your use in order to make things easier for your line of work. We know that when the CDC put out information, they left the discretion to be up to each organization's occupational health department, but we understand that organizations can be big or small, and not everyone has an infection prevention infrastructure set up. And that is why we're definitely looking forward to future topics. So some of the future topics, and I'm actually going to leave this up just for a second with hopes that you all will chime in our chat. So our future topics for tools and webinars will include our patient assessment tool, and that will also be available up under the tools under our Monkeypox resource page. We'll also have an emergency triage tool. And so that tool essentially with our work with the Emergency Nurses Association will be that quick tool that someone can assess someone quickly with 2 to 3 questions, just to understand how they would need to be triaged or move away from other patients and healthcare workers for safety. When we talk about practical tips, it can be bathing patients with monkeypox. It can be oral hygiene. So what is the protocols, let's say, or if there are any around changing out a toothbrush? When we think about healthcare worker uniforms, not every hospital has laundering programs. So how do you go home safely after caring for a patient with monkeypox? Food service, handling food and when to consider disposable utensils. Hand hygiene for patients with monkeypox virus. And so there's some emergent studies around that area that is showing a high prevalence and how it transmits around the room. And then parent instructions when they're providing care to a child with monkeypox that is in isolation. And so as we know, we're starting to see some outbreaks in daycare centers. And so that is also going to be on the rise in terms of an area of discussion. Healthcare workers with autoimmune skin diseases, and not necessarily eczema being highlighted as one because we know that there are others, but the skin sensitivity is a big factor, and just any broken skin can be a risk factor for someone that may be caring for a patient with monkeypox. And we haven't touched on at-risk populations, even pregnant healthcare workers. And so there are topics absolutely that we recognize we can't build Rome in a day here, but they are on the rise for the work that we will do. And the other is when we're thinking about monkeypox management for home care settings, just as Donna pointed out, what information can we provide to others? So this is just providing a topics list of some of the things that we're covering. If there is anything on this list or you feel that there is something that should be added that is not covered or maybe not covered in depth, we welcome you to include that information now at this time. We will take a look at it. There will also be a survey afterwards for which that information will be shared. So now at this time, I'm going to stop sharing my screen because I would like for us to engage in Q&A. And before we do so, just remember that these are the sources for you to find more information. And now we'll engage in Q&A. So stop share. There we are. So if my wonderful panelists can come on screen so we can answer some questions, then that'll be great. And so I'm welcoming back Barbara, Donna, Anna, Rashida, and Jennifer. Thank you so much. And so going into, thank you so much. I'm seeing some questions still continue to come through as well as suggestions for topics. So thank you. I believe that this question has been answered, but I'm going to give it to Barbara just for a little bit more clarification. Barbara, can you clarify how to handle linen and waste? The CDC guideline is a bit complicated, and they're looking for something more concise to write into a policy. And so I know that we provide some information, but maybe you can help with that.
Yeah, that's always one of the issues that comes up with healthcare workers. How do you handle the waste? So I think the distinction that makes it confusing in the CDC guidelines is because they talk about the clade 2B, which is what we're classifying this strain of the monkeypox virus during this outbreak. So that does not make it, the more stricter organisms are classified as category A. And those organisms, which this strain of monkeypox virus is not included as a category A, they call it clade 2B, does not need those extra special handling or autoclaving waste like we did when we were talking about Ebola or some of the other hemorrhagic fever diseases. So handling this waste is red bag garbage. We're calling it biohazard. I have not come across a state that's not used red bag garbage. So regular red bag garbage would be the way to dispose of everything. The one distinction that we did want to point out is that in this case, we do want you to put the personal protective equipment, the gloves and the gowns in the red bag garbage in the patient's room. And if you do need to replace your eye shields or your eye goggles, we need you to disinfect them before you're going back to, let's say, the nurse's station. So I know they make it a little complicated. They should just say biohazard waste, red bag waste. Now, in terms of the linen, we really don't need, we should be handling our linen safely like this all the time, right? Those of us from the old school nursing And old school nursing attendants knew not to shake the pillowcases out. We don't want to disturb or disperse anything that was already settled onto the horizontal surfaces. So have the linen directly into the linen hamper, and then it can be treated in the regular laundry that you're using in for all of your other patients' linen as well. I think that the waste part was the part that was more confusing than the linen part. Thank you,
Awesome.
Shana.
Thank you so much, Barbara. I greatly appreciate that.
I think we're
And-
doing the Q sooner or later, right, as part of this? So maybe that's one of the things to add to it.
It sounds good to me. So Jennifer, if you can tell us, what are the suggestions? Like, do you keep pustules and scabs covered or open?
Is that for me, Shanina? Sorry.
Yes.
I'm gonna kind of turf this to my APRN specialist, education specialist, Anna. She is our nurse practitioner who probably has more in-depth information on this than I can provide.
Thank you, Jennifer.
Sure.
Thank you, Jennifer. So obviously the concern is to minimize exposure to these lesions. And it is important to obviously maintain the, the contact minimal, and obviously use your PPE. But in regards to the lesions, you want to minimize exposure to other potential contacts to skin. So it really depends on the lesion itself, and making sure that you always wear PPE to protect yourself when encountering a patient with one of these exposed lesions.
Thank you so much, Anna. And Donna, I'm going to pitch this question to you. But if I am a frontline worker and accidentally my skin, whether it's my arm, my hand, comes in contact with a monkeypox virus rash, sores, or scabs, what should I do? Like, what is, I would say, the actions that I should take at that time? And even if you just provide a brief overview of what that would look like.
Okay, well, that type of contact would be considered more of a high risk exposure. The first thing to do, the first immediate thing to do would be to wash the area really well. You're gonna, as soon as you can, make sure, you wash thoroughly. And then you're gonna contact your employee health department. If you have one, your infection control department, however, whatever your policy is at your facility. You're going to make that first call and go in and be evaluated. If they're using a screening tool, of course, use the screening tool, explain how you were exposed, and you would be eligible potentially for post-exposure prophylaxis. But of course, again, that depends on that evaluation with your employee health or whatever your facility does for injured workers. That person is going to make that determination.
Awesome. Thank you so much, Donna. And this goes perfect into my next question for Barbara. So Barbara, currently, as we know it and based off of CDC guidelines, how is monkeypox treated? Like, is there a treatment for monkeypox, or are we bartering from some other kind of illness? Like, what's happening right now with that?
So as Donna had mentioned, people that are exposed have the potential for needing post-exposure prophylaxis with vaccine, which is a very specific criteria to meet. And as Donna had said, you would follow through with your either public health or the employee health service that you're at. But there is no specific treatment for the person with monkeypox that's confirmed. There is a similar drug used for other viral diseases called TPOX that has shown some benefit. Most of the treatment is symptomatic. So many people have been coming in with a lot of pain in the perineal area. So a lot of it can be pain management symptomatology, or as Anna was talking about with the lesions, it may be in terms of wound care for the lesions, depending on, how bad the lesions can be.
And
There's
just
just specific treatment. It's more symptomatic treatment right now.
And just to add to Barbara's point in regards to antivirals, those are usually more for people who are severely ill, patients with weakened immune systems, immunocompromised conditions.
Awesome. Thank you so much to you both. And so we had another question that came in. And so it mentions a previous slide stated that the door should be closed to a monkeypox patient's room. Is this only for patients that are receiving aerosol generating medicines and in a negative pressure room, or for all monkeypox patients? So they're wanting clarity on the door being open and closed for a monkeypox patient's room.
So I'd like to also add the part about whether it's when we get confused with using an N95 and assuming it means airborne. So remember, when we're using airborne precautions, we need a special room for that person, which is why we don't call this airborne precautions. This person can be in a regular room with the regular number of air exchanges that your hospital or your clinic or your doctor's office has. That's the difference. When we say close the door, and this is a question with all of the isolations, really, it helps, I think, to manage the transport of people in and out, the traffic going in and out, the equipment going in and out. So sometimes it may help with some of the aerosolization if somebody might be aerosolizing, but it's also sort of a traffic control so that we know the person is in that room. There is, of course, the CDC says if this is possible. And if you have in your nursing judgment and your healthcare judgment, know that you have to keep an eye on that patient, then you're going to keep the door open, or, have somebody sit outside the room if you're doing like sitters or close aids or something like that.
Awesome. Thank you so much, Barbara. And Donna, this is for you. Where can I go if I have further questions related to potential exposure to risk to monkeypox in my healthcare workplace, or in any workplace, I would say?
Well, one of the best resources we do have is the CDC website, actually. They've got a tremendous amount of resources there. So I would check there. Certainly, your own facilities, policies and procedures, but if you're the person writing those policies and procedures and you're trying to put that all together, I would start with the CDC, actually, because they've got a large section of clinician. There's a clinician FAQ section. There's a clinician treatment section. That would be my first place to go.
Awesome. Thank you, Donna. And Jennifer, this is for you, and it's more so a little along the lines of what Donna is asking. So we have attendees that want to know if a facility launders their own gowns, if there's any specific instructions, but I think more so than anything, what resources are available that if they have questions about laundering gowns, if they have questions about, changes in practices, where would you recommend that they go for that information? And how frequently would you advise them to check back?
Yeah, it's a great question. When you really start talking about changing practices or moving from on-site laundry operation to an off-site or a third party, there's pros and cons to it both. You can have the linens whenever you want, but after your patient mix changes or things like pandemics or endemics happen, the laundry volumes might change, and then the protocols change related to those laundering practices. You do need to balance all of that out. The unit per cost, the supplies, utilities, all of that. Some of those measurements, just as a sidebar really quickly, is to think about is the laundered utility costs, the equipment that's in play, and all of this has to do with how frequently we're going to be laundering. In COVID, we learned some lessons about how frequently we had to reuse or use gowns, especially in the patient populations that we had to keep in isolation, and how frequently we were changing those the patient gowns. So then you need to really also think about the cost to maintain that linen inventory. That also, oddly enough, a lot of lessons learned in COVID was a lot of facilities then decided to go and dedicate themselves to sustainability. So keeping all those costs in mind, there are a few resources. A lot of infection prevention sites do help hospitals to look at those costs. Whatever third-party vendor or laundering facility organization or company that you do have in your area, whether it's an urban or rural area, would also have those resources. But it's really going to be down to really your occupational health department, your employee health department, and your organization itself to determine those cost, risk, benefits of maintaining that laundry service and the protocols that go into place, because every facility is different based on your patient population. So, taking what Donna and Barbara both said into consideration, that would get weaved into the decision-making of, if you have an outsourced laundry service, what protocols would you want to put in place to maintain that laundry service, and if it's cost effective for your facility or not. I hope that answers your question.
It does. And thank you so much, because we actually got a 2-for-1, because we had an attendee that had that very question as well. So that was very helpful.
Great.
I would also like to ask, and Barbara, this is going to be pitched to you, because we hear terms, right? We hear droplet precautions, we hear contact precautions, we hear special droplet precautions, and we have an attendee right now that typically mentions that the N95 has been indicated for only airborne, but we know that with these emergent pathogens, things are really changing because they're evolving, and in so many ways they're trying to outsmart us. So if you can just provide a little bit of information around those terms there, so we can kind of clear up, I would say, the muddy waters.
Thanks, Shanina, and thanks for raising that question. I think everybody has that on their mind. And I think the premise is that we'd like to offer our employees and our healthcare workers the highest level of protection that's possible, while still being able to deliver safe care, right? So that we don't want to be in that mode where we first were with COVID, that everybody had to be in huge Tyvek suits and nobody could last more than a few hours. So we want to make a distinction of the N95 is being used as a source control for the employee. And if you think back, most of the surgical isolation masks were intended to protect the patient from me, so that I wasn't basically spitting on the patient. Whereas the N95 or higher level particulate respirators are intended to keep organisms from entering my airway. So we should try to, I know we put them hand in hand, the airborne precautions, the airborne isolation with N95, which is great, but we should try to look at them as two different control measures, two different hierarchical control measures. The engineering controls of the room is one thing, and most of us will have no control over that, but we all can control whether we're going to wear an appropriate face protection. Well, most of us can control that. We want to make sure that everybody has some availability of some protection. And we've learned from COVID that some protection is better than none, but the higher level or the more layers that you have, the less likely you are to inhale something. So that's a great point, though. And it's a good point for you to bring back to your colleagues on like how to encourage them to use the N95.
Thank you, Barbara. And I was going to say, I think too, that this just brings up the conversation about culture, because we have, let's say, had those 3 buckets of terms for so long.
True.
And we've been used to a certain level of practice that as we start to overlap and the N95s are starting to be, I would say, more normalized in terms of an everyday practice, I think the pushback is coming like, wait, we didn't used to use these in practice every day or as frequently. So it's like you would undergo that fit test, let's say once a year, and it might only be maybe 2 or 3 times out of the year that you would use it, but things are changing. So I think it's good that we actually acknowledge that. And so I'm just going to open this up, and maybe we can have just a little bit of dialogue about it. But I know that Josie asked, so one of the attendees asked, how do you clean or sanitize the room after testing for monkeypox for the next patient? And Barbara, this is a little bit more in your wheelhouse, but I'm hoping that we can just talk about it a little bit. I know that the testing just in itself, like the procedures, are on the CDC's website, but maybe if there can be some clarity around that question or some more insight to that question.
I think that if we were doing good cleaning to begin with, we would be okay with this, right? So we want to know that we're discarding anything that's disposable before the next person comes into that room. And then we are disinfecting all the high touch situations, high touch locations with the disinfectant that's that EPA registered. So of course, this is hard turnover sometimes if you're in a busy clinic to make sure that each person gets the same level of cleaning as the next person. It's sometimes easier if you're in an acute care setting because we can hold the room, we can have housekeeping come. We do not need any special extraordinary, hydrogen peroxide vaporizing or UV lights. If your facility is already doing that for certain things, great, but it's enough to use the EPA disinfectants. The challenge, of course, is those high turnover areas where you might be seeing patients, 20 in an hour to get through to make sure that the high touch areas are disinfected.
Got it. Thank you so much. So with us only having about 4 minutes left, I'm hoping that we can all, I would say starting with Donna, just do some closing thoughts, just for us to close everything out.
Okay. Oh, I didn't know you would start with me. No. I appreciate the fact that we were able to pull this together, and I'm so appreciative of all the participants spending time with us. I hope these tools are useful, and certainly, we're going to be doing more work in the future, and I appreciate the collaboration. Thank you.
Thank you, Donna. And Barbara, I'm pushing it back to you.
Well, we're very excited to have such a crossbreed of people that are interested in this topic. And we learned from the questions, we learned from the comments, and please keep them coming. I know that Molly and Natasha have an evaluation form that'll help you. You can just put anything down that you're thinking of, monkeypox or not related.
Thank you so much, Barbara, for reminding them that an evaluation form would be coming. And Anna, how about you?
Just want to thank everyone for participating. We are so happy that we could bring you this content, and just like you, we are staying on top of this and making sure that we're keeping up with the updates so that we can bring you the most up-to-date and current information to help you stay safe in your workplace.
Awesome. Thank you. And Jennifer?
Yeah, ditto to what every of my other colleagues here have said. Thank you to you guys at APIC for this great partnership in putting this together. Just excited to be able to get this information out. Quick turnaround, trying to get things out, and really look forward to all the information that you all as participants will then give back to us, so we can put out the right tools and the right resources that's specific to your needs. So we are really looking for getting your feedback and your input so we can directly give you the tools that you need so you can practice safely and effectively and take care of patients and families, as you are dedicated to.
Awesome. And Rashida, Dr. Jones. So last but not least, one of our ANA's Project First Line leaders, based off of what you've heard today, as well as the information that is being offered, if you can close us out.
Sure, I'm happy to. I want to remind everyone about the foundational principles of infection prevention control that are really important in preventing the spread of monkeypox. So we're talking about our standard precautions that are fundamental. So think of hand washing, proper cleaning and disinfection, conducting those risk assessments to identify the proper PPE, and then of course ensuring that we carry those out. This is actually what's going to help us in preventing the spread of monkeypox. You can actually get more information on some of this very important foundational IPC prevention strategies by visiting ANA Project First Line. Thank you all so much for joining, and we look forward to future sessions with you.
Awesome. Bye, everyone.
Bye.
Thank you very much to everybody that participated in our program today. Just a reminder that on-demand recording along with slides will be available within 48 hours. This webinar is not accompanied by any credit today. Detailed instructions with a link to access the on-demand recording will be emailed to all participants. This concludes our program. Thank you so much. You may now disconnect.